So George is the director of the program in exposure assessment and human health effects at the Department of Environmental Medicine at NYU, and he's a leading scholar on the human health effects of air pollution. He was also an author of the most recent WHO Global Burden of Disease Report, which was published in 2012, providing global estimates for life years lost due to outdoor fine particulate matter. More germane to his talk today, Dr. Thurston has been a leader in advancing the intersection of science and public policy decision-making, testifying before Congress on dozens of occasions, and most recently on October 2011 regarding the proposed mercury emission regulations. He's also served as a member of the US EPA CASAC, that's the Clean Air Science Advisory Council, as well as on the NAS Advisory Committee on Environmental Aspects of Waste Incineration. He's frequently been interviewed by networks in the press, most recently on A Toxic Tale, Trump's Environmental Impact, which also featured PRE's ECHO study and focused on methylene chloride, which I will cover later in the TSCA section. So now I will give you control, George.
Okay, the only problem is, in the meantime, I've lost my screen that had you on there, so I can't see what you're seeing. Yeah, sorry. I don't know how I can, let me see, maybe this is it. Ah, there it is. Okay, I found it. I have too many screens open. So yes, I'm going to talk about the perils, and this is something that's been around for a long time, so I'm going to give a little bit of the background. Let's see, how do I move the, let me see, can I move this? Oh, okay. Do I have to say next slide, or is there a way I can control that?
You can tell us next slide.
Oh, okay. So this is something that's really imminent, and people should be aware of this, this proposal's been around for a while, but word has leaked out. I think the New York Times had an article on this, that the EPA is poised to finalize this rule to limit the types of scientific studies that can be used to create new regulations. And, you know, you say, well, okay, how often do we do that? But with the Clean Air Act, for example, every 5 years, they reevaluate the science, so that this proposal, if it were to eliminate a lot of science, would then cause them to say, well, gee, there's no evidence to support the standards as they are, and so we'll relax them, as one example. So what would this do? It would require public health researchers to release their raw scientific data in order for their work to be considered when EPA sets regulations. So that sounds sort of reasonable, that people should make their data available, but, and we're all in favor of transparency, but we have the contrary requirement to protect the privacy of the people who were involved in studies. We promise to do that, and if we don't do that, then, and we violate that, I don't know what the legal implications are, but certainly one of the implications would be that people wouldn't want to participate in studies anymore. Next slide. These regulations, as I alluded to, dictate things like how much pollution can be emitted into the air and water. And this is a rule that vested industries, such as the tobacco companies and the energy companies, oil companies, have wanted very badly for a long time, as I'll show you. And basically, the theme here is, if you don't like the message, kill the messenger. And in this case, the message is environmental health science, is saying that pollutants that these industries are causing are having adverse health effects, and they don't like that message. So they want to muzzle that. When the rule was first proposed a couple of years ago, the agency received hundreds of thousands of comments, the majority of them in opposition. But whether they'll listen to that seems doubtful. Next slide. So yeah, so here's specifically what the regulation says. The proposed regulation provides that when EPA develops regulations with regard to the scientific studies that are pivotal to the action being taken, EPA should ensure the data underlying them are publicly available and are managed sufficient for independent validation. And what they're talking about really is getting the data and putting it on the web. Now, it can be de-identified, but I'll talk about that in a minute. There are problems with that. I know I've talked to scientists and they said, well, we can just de-identify the data, but it's not that simple, especially with environmental data. Because if you know multiple characteristics, let's say, of exposures, as the ozone levels and NOx levels, the SO2 levels, and other variables, the altitude, whatever, you can start to narrow down quickly who that might be and match things up. All right, next slide. And just to give you an idea of where this comes from, this transparency initiative really goes back to, and I apologize for the noise, I'm in New York City. There's a fire engine going by. A consultant, a lobbyist really to the R.J. Reynolds Tobacco Company sent this memo that I've got a little excerpt from to the R.J. Reynolds Company. And he basically laid out this proposal. This proposal, they've had this waiting for their moment to push it through and make it happen for decades. This is from Christopher Horner. It says Homer, but I think it's Horner, H-O-R-N-E-R. And he's talking about environmental tobacco smoke in 1996. He says, because there's virtually no chance of affecting change on this issue if the focus is the ETS, in other words, the focus is on the science, our approach is one of addressing the process as opposed to the scientific substance. That may sound familiar defense, where instead of looking at the facts, they want to look at the process. But anyway, that's another issue. But I've given a link here to the actual thing. And this came out of the bin of documents, the treasure trove of documents that UCS, that it's not UCSF, is it? It's the tobacco trove from Union of Concerned Scientists. That's what it is. It's a typo. All right, next slide. So at the time that this happened, you saw that memo in 1996. And by July of 1997, Representative Alder Holt, I think it is, put forward. So it only took a few months, and they had a bill to put before Congress. And so they jump fast. When industry says jump, they say, well, how high? And as you can see here, I started out with show me the data. Sounds a lot like a soundbite from a Hollywood movie, but it accurately characterized the demands that U.S. industry representatives and legislators on Capitol Hill have in recent years been making of researchers who study environmental and occupational health problems. So this is from 1998, I published this. And the issues that are out there, if you're following this now, these are all exactly the same issues because it's exactly the same problem. And Christopher Horner, actually, I should mention, he was the one who came up with that. He also I've been told, I've read, that he was on the transition team for the Trump administration and was involved in picking Scott Pruitt for the head of EPA. So you see, it doesn't take you many dots to connect this back to vested interests like the tobacco companies. And the issues I raised: research credibility, confidentiality of participant medical records, intellectual ownership rights of your work, effect on scientific progress, in other words, who will participate in studies, unfunded mandates, it costs a lot of money, are existing mechanisms sufficient as they are? And I give a link to that paper, which I put into the record at EPA when they've been considering this. And that's something that people should do, by the way, if you introduce new evidence and you talk about it or you give a reference. When this goes to court, if it does, and it likely will, then the court can only consider the documents that are in the record. So just saying, oh, go look at this paper and you'll see, that won't help in a court case later on. From what lawyers tell me, you really have to put the article in the record, and then the courts will later look at this, because it could very well, likely will go to court. All right, next slide. So here's the issues that I was alluding to: compromise of medical records, confidentiality. Now, I talked about this 20 years ago, but today it's really, really a big problem, because in this time of big data, it's too easy to crack the de-identification of data. And there are reports out there, which I don't reference here, but there are a couple of papers out there where people show that with just a few identifiers, they can identify over 90% of the people in a data set, and break the code. Rocher, I think, is one of the authors. Rocher is one of the authors recently. It was a big article in the New York Times about it. And also just the Golden State Killer. How did they find the Golden State Killer? They looked and looked, they couldn't find, but they combined two big data sets. One was the history. They had a data set that was from Utah, that was family histories and things like that, and had DNA in it. You know, you do these tests of DNA, 1, 2, 3 and me or whatever, and they had one of these data sets that had that in there, and they had DNA from the killer, but they hadn't been able to match it. So then they took the big set, the DNA they had there, matched it with this other data set, and they didn't find the killer, but they found a relative. And then they said, well, this almost matches, so then we can go back and we can identify this person. Now, in that case, it's good that they found the person. But basically, it just shows, but by taking two big data sets and combining them, or three, you know, you get all these multiple data sets, you can identify virtually anybody with just a limited. And with environmental data, it's really easy because you're giving them locational information about what the environment is. The abuse of research data undermines science credibility. There's lots of examples of this where they've done this already. In the state of Georgia, they had a law that was similar to what they're proposing here. They have it still, I believe. And so that when they publish, they have to release the data. And this researcher, Fisher, Dr. Fisher, published a study showing that children who were exposed to these characters in advertising. This is why they don't allow advertising anymore for cigarettes. Joe Camel and other characters, you know, and smoking cigarettes, that those kids were more likely to be aware of cigarette smoking and so forth. So, and he published that, and they got a hold of his data, and then they ripped it apart, and they got these basically gunslinger statisticians to say, well, no, it doesn't really show that because we use some other model. And they can always come up with a model that will make something go away if you want to violate basic modeling rules. They did that. Of course, his research was later replicated, but they put his research on hold, and he just gave up on research. He went back, and now he practices. He's a practicing physician in Georgia, and he's still around. I've talked to him since then. Paul Fisher's his name. And then a lead effects on kids. They have gone after Needleman on his research. So there's a lot out there that, and then of course I mentioned the tobacco Trump administration connection, Christopher Horner. And then there's loss of your intellectual property. In other words, you go and you spend years collecting all this data and you want to analyze different aspects of it, right? And then they're saying, no, if you want to make, you know, the first paper and you want us to consider that in the regulatory process, you have to put your data out there and then anybody can analyze it. So then, you know, you spent years getting a grant and getting data, and then you lose publications, and it can derail an academic career that way. Imagine if you only got one publication out of any study you did, you know. And then there's government unfunded mandate. Nobody likes unfunded mandates, and this is one. And they've estimated when they brought one of these bills before the Congress in the past, Lamar Smith was the fellow, another Republican, brought this forward, and they did an analysis, and they said it was going to cost the government $250 million per year to go through and process and handle all of this. So and then there's also the cost to the researchers having to gather up their data and de-identify it and as best they can. All right, next slide. So, well, what's the alternative? You know, in other words, they're saying, let's let the sun shine and we'll get this out there. But the downside of doing it the way they're doing it is so bad. I mean, the fact is, this is a problem that doesn't really exist. There's already a peer review system for all published papers. They can do replication and have done replication by independent researchers and populations. In other words, people have looked at the same question in different people look in different populations to see if it's compared. The idea that reanalyzing the data, the same data over and over to get a different result, it's not the way science really works. What you want is an independent test. Sure, we should check and make sure they did things properly, but that's the peer review process that looks into that. And then if that's not satisfied, then in the past, for the 6-city study, if you're familiar with air pollution studies, and American Cancer Society study, which I was involved in, the Health Effects Institute offered, and they took the data and, they were given permission to have the data, and they did it securely, and they reanalyzed it, and they were able to reconfirm the results. So if there are really controversial things where people say, well, this is a one-kind study that's really important, then you could give it to an independent body without making it public for everybody and test that out. So basically, the system is working. The only thing it's not working for is the polluters, and that's why they're unhappy, because they don't want these studies. So they have to if you don't like the message, kill the messenger, and that's the real goal of this proposal, is to eliminate science from government decision making. And by the way, next slide. By the way, this applies to much more broadly. In other words, this is just the first step to suppressing science. It's not just the EPA. You can expect this to be the FDA, all of these agencies. They're going to try and eliminate science from the decision making. So it can be totally political. And so its implications are, this might be just within the air pollution world, could be retroactively used to strike seminal studies. If they say, well, we can't give up the data, we promise not to give it up. They'll say, okay, that's fine. We respect that. Now we don't consider that study. So they could take these studies out as the different investigators say, I have to respect the privacy of my patients. Because if somebody gets these data, then there's not only the question of trying to undermine the study, which I think is a valid one. The other is the data could be used against the people who are in the studies. Their health data could be used they might have a pre-existing condition. So then the insurance companies find out about this, and then they raise their rates. Could be used to steal identities. Be getting a lot of information about that person, and then you could, using all that information, go in and take over their accounts and things like that. There's all sorts of negative implications to putting data out in public that people can then just de-identify and steal. But the big thing is, from the people behind this, it represents a gift to vested industries, vested interests, really, to avoid additional environmental regulation. If there's no data, if they're able to say, okay, we can't consider your study, and there's no data, so then there's no science, and then if there's no science, there's no regulations. And that's the simple sort of equation. I can't remember this. I think there's another slide, one more slide, just the sort of a conclusions. And so basically, this rule would harm public health because it would make it so EPA can't protect public health. And vigilance from the public health community is critical. So I think people need to get involved with their professional and society's efforts. I think, it sounds, like we can't do anything about this because they're going to do it. They're going to ignore all the thousands of comments. But by getting things on the record, and then later, when a neutral party looks at it, then they'll say, oh, well, they had lots of information that they ignored that's right there in the record that, the American Public Health Association, the International Society of Environmental Epidemiology, the American Thoracic Society, all of these groups put their information in, and they put documentation of what the problems were. And so then hopefully in the courts, if this does go forward as it seems it is, then there is a way to fight it later. But if it isn't in there in the record, then it's very difficult. They can only consider what's in the record. They can't look at new information when they're reviewing it. And I give a couple of sources of information for people generally. Certainly UCSF, their program on reproductive health and environment, I give the link that you can hear about these developments and maybe get involved. and also the Union of Concerned Scientists, which I mentioned before, but had the wrong acronym. Center for Science and Democracy, and they get a lot of information. One of the things they did was they supported the particulate matter committee that was dissolved by EPA because they said we don't need scientists' advice to come up with the regulatory decisions, basically. And so they dissolved those committees that were traditionally used to advise the SAB. So they kept the particulate matter one going, and they met anyway, sort of as a independent panel, and they put in their recommendations. So again, that's in the record now. So that's I think one of the important things is for people to get involved. You can make a difference, and your societies can make a difference if you get involved. And I would say, having been doing this for a number of years, it is difficult to get people to take the time to write comments, substantive comments, and to call in and present to the EPA when they have their meetings. So yes, you will be needed. If you volunteer to your societies to get involved with these activities, I think there's a good chance that you'll be able to help, because they really, everybody's got busy lives. And so if we split it up more evenly, I think we can do a better job. Thank you. Any questions?
Hi, everybody. This is Swati. Thank you so much, George. That was an excellent presentation. I chatted to everybody that they can feel free to take themselves off of mute and ask a question, or you can type it into the chat box and we can ask the question for you. But we'll open it up for about a 10-minute Q&A. So.
Well, if nobody else has a question, I'll ask a question. This is Dina Singla with UCSF. Thank you so much for that very informative presentation, George. I think it's is really useful to understand the history behind this current proposal, and I wondered if you could speak a little bit to what was important in defeating these efforts in the past, and if you think some of that could be brought to bear on the current proposal.
So you're saying, well, they've had 20 years they've been trying to do this. Why didn't it happen?
Mm-hmm.
Well, mostly it was because the Senate. Mm-hmm. They couldn't get it through the Senate. They tried every, trick, like putting it into bills late at night, the last minute, and things like that. But when it went to the Senate, the senators were, what do they say? The Senate is the saucer that cools the hot tea from the mm-hmm. House, and so they were always, but. So they could never get it through both houses or the president. Then we had Obama as president. He's not going to sign something like that. Mm-hmm. And even the Bush administration really wasn't, as I recall, wasn't in favor of this. It just couldn't get through. So what they've done is they've done an end around.
Right.
They said, we'll just do it administratively. We have a lackey in the White House who will mm-hmm. let us do as we wish. I don't think this is not a Trump thing. It's a vested interest thing, and they got their boys in the EPA, and they're going to push this through. And they've wanted to do it for a long time. Trump is just a willing participant. He's willing to let it happen.
Right. Yeah. Thank you. I think that's exactly right.
Awesome. I have a question from SL7053. I do not know who you are, but great question, which is, George, what would be the basis for a legal challenge, and what legal standard is being violated here?
Well, I think, I'm no lawyer, so I don't know, but I'm sure it would be questioned and fought. I think the main thing is that they're just not listening to the facts. In other words, they've got lots of evidence that this is a bad idea, that this will not be in the best interest of the public, and they're ignoring it and moving ahead with this anyway. So I think that, being a non-lawyer, that that's what the argument, and I think it's a valid argument, will be. That because there's lots of evidence in the record. Many people have put forward these same arguments that I really laid out 20 years ago, but updated with new studies that confirm those concerns.
And this is Vina. I'll comment on that quickly. In the original rule proposal, EPA cited a number of statutes as far as its authority to make this rule, but in the leaked version of the supplement that came out from the New York Times in December, there was only one sole citation for EPA's legal authority to do this rule. That was a very old statute, like I want to say from the 30s or 50s. And when the House Science Committee held a hearing about this science transparency rule, that legal authority was questioned in that hearing. So I think that will be an important point of challenge, is there authority for EPA to do this within the existing law? I think it's a very valid question. EPA hasn't really supported that, it seems like.
Yeah, and that was Stephen Lee from Bloomberg Environment. Thanks, Stephen. Yeah, and I think we also, if anybody else would, have any opinion, we did have a few people who were attorneys who registered, but I don't know how many of them made it online. So, feel free to also share. This is everybody's webinar. Any other questions?
I could say they had a hearing about this that Mary Rice from Harvard represented the American Thoracic Society. But they asked this question of everybody, and the Democrats get to pick some people and the Republicans get to pick some people to be, and they all said that they did not approve of this proposal across the board. All the witnesses. So it's worth going back. I think it's on C-SPAN. It's worth going back and listening to those that day. I think it was in November that they did talk about that. I want to hear more about this proposal and opinion.
Yeah, I agree. It was a really informative hearing. We'll find the link and share it.
Okay, good.
Anybody else? We have a few more minutes for questions.
But I just want to say people should get involved with their societies. I think, and these times when science is under so much attack in so many ways, funding-wise and so forth, that the professional societies are involved with these things, and they're looking for people to help out and to work on these issues through your committees and so forth. So, whether it's the American Public Health Association or the American Thoracic Society or the International Society of Environmental Epidemiology or others, check in to see what you can do, because you really can get involved, and they're looking for help. There aren't staff to do these kinds of things. It's really up to us to get involved, and it's better to do it now than after the fact and say, oh my God, what happened? I wish I had done something.
We couldn't agree more.
Honestly, yeah.
And we'll actually provide a little bit more information on that too.
Yeah. So I guess if there's, unless there's any other questions, we'll move on. Going once, twice. All right. Thank you so much, George. I really appreciate it. And you're welcome to stay on the line for the remainder of the webinar if you'd like, or if you have a meeting to run.